All right, it is 1 o'clock. Let's get this going. So I want to welcome you all to our summer educational series. I'm the founder and CEO. Many of you obviously know me. I've been blessed by having ongoing relationships, partnerships, communication. They know, my whole team knows that communication is a pet peeve of mine. We've really worked extensively over the past decade, listening to you all and making improvements into the system to make it more intuitive, efficient, and really support you. Today's webinar is focused really on a compliance tool that we've added into the system that we really would like you all to get more comfortable with. It is the required encounters. So as CEO and founder, I have to thank you for your partnership, your growth within AZZLY, your loyalty, and really working well with the team. We really appreciate you. We're glad you're here, and we hope you find this beneficial. Today's webinar, again, on the required encounters, we designed it to better support compliance and hopefully boost timely reimbursement. It's a wonderful tool. It's something you can get used to. It's something you can turn on, turn off. You can add it to one encounter or multiple encounters. For any of your licensed providers, this is a fabulous tool in order to stay compliant and on top of your timely requirements. So today, you all know Maria Gray. Maria's LPN and she's product manager. She's lead on-site implementation specialist. Maria's been working in the industry over 10 years. She enjoys going on-site, working hand in hand, doing the kickoff calls, learning about the clinical workflow and staying on top of what's new and what are the needs as more requirements are handed down in this sector of healthcare. We also have Heather Junkins. Heather is a revenue cycle management manager. She's a specialist. She is our senior manager and 15 years experience on the RCM side. Heather has been enjoying training many of the new facilities that join us in treatment centers. So really happy to have Heather on board the team and working closely with Maria and our implementation specialists and Joyce and the entire RCM team. So keep in mind again that you can start easy on this. It's all about the encounter. It's all about facing some of those challenges that keep you from getting your work done timely, or if you have an audit, all of a sudden you realize, oops, you know, I forgot to do some reviews. I forgot to do this or that or the other thing. It's a wonderful feature. There's no cost to it, no extra charge whatsoever in AZZLY Rize. So please consider it as a compliance tool. And with that, I'm going to turn it over to Maria and Heather. Go for it, Maria.
Thank you, Coletta. So I would like to begin by sharing my screen and thank you for all of you who have joined. We do have some familiar faces on here and many of you who I look forward to getting to know. And now this is going to be somewhat of a high level, I would call it training / overview, primarily an overview, but I want to go deep enough that you all can see the back end and know that, hey, this is something not only that we could use, but that I can manage and keep up with and configure on my own, you know, as I need to. So I'm going to share my screen and jump right into screen you all are familiar with, except I'm lucky I have a few less patients than most of you probably do. So before we go very far into the feature that we're discussing today, I know that we have some users on the call who don't use encounters at all. So in case you're one of those, I first want to just define what an encounter is that we're referring to. So an encounter is in AZZLY is essentially a group of forms that allows you to it's a configurable screen that allows you to add forms to a group so that when your staff are documenting, they don't have to sort through an entire library of a list of forms and you're hoping that they pick the correct one to document as services that were provided. Rather than that, it allows you as a super user to establish the services that you provide, the appointment types that are in your system, and what documentation you require to be completed for that service or appointment type. Now there are a couple of different ways, and I'm going to go into some deeper screens here. I just want to, before I distract you with my screen moving, explain a few pieces of this, so bear with me. When you are configuring encounters, as I'm going to show you in just a moment, you have the ability to set the required documentation, as I just mentioned, but you also can select to add optional forms. So for example, maybe in an individual session, you want your staff to always complete an individual session note, but you want them to have an available optional treatment plan or Columbia suicide, or something along those lines. It allows you to have both required and optional forms. So I'm going to go into the encounter screen in just a moment, but one other aspect that I want to describe before I go into that is the feature of teams in AZZLY, because this I feel is an underused feature in AZZLY. Teams within AZZLY allow you to group staff members so that when performing various functions throughout the system, you're not having to identify staff members one by one, but you can instead have a group, for example, a clinical team, a medical team, an administrative team, et cetera. And the reason I bring that up on this call is because not only with teams can you filter the calendar to see everyone on a team's calendars at once. So for example, the clinicians' calendars at once. Not only can you send a staff communication message to an entire team all at once, but you can also assign encounters to be or you can assign certain teams to be responsible for documentation all at once. So as I mentioned this, I'm going to go ahead and jump into the required encounter portion. I'm going to begin on the back end in the configuration screen. So I'm going to go to configuration and encounter types. I know some of you do already have the privilege to access some of these areas. And if you do not, and you're interested, of course, with any of this, reach out to us after this call and we can set you up and go into additional training if needed. So within the encounter type screen, if I have some encounters already configured, I will see those available in my drop down here. I'm going to go ahead and select an encounter that I've already set up just so that you can see essentially how it would be laid out for you when you're ready to have yours completed. So the one I'm going to use for right now is going to be the clinical admission encounter. Now, the name of my encounter displays at the top. As you can see, there are some pink check boxes that do not have any reference to documentation, as I was saying, as in the encounter, but instead you're familiar with our level of care tab, our insurance tab, diagnosis, medications, vitals, allergies tabs, all of those tabs that give you quick access within a patient's chart. You can also choose to have these included in your encounter screen. So in that one screen that has your required documentation, you can have these tabs also immediately available so that you're not having to leave, come back, and move around throughout the system in order to access the information that you need. So for this admission encounter, you can see which ones I have selected to be included. Many of you are also hopefully familiar with our work supervising provider signature feature. This allows an automatic alert to be sent to a supervisor when an encounter of this type is finalized, if this box is checked, and if that user who's finalizing the encounter has a work supervising provider assigned. That's a great feature. One also that if you're not familiar with, I encourage you to reach out about. I'm going to come back to this one in just a moment. Speaking of the encounter setup though, I have created various form groups for this clinical admission encounter. As you look down the screen, you'll see that there are only pink check boxes under the is required section for only 2 forms. As I noted, when you create an encounter, you can have those forms that must be completed and those you would like to have optional. In this given scenario, I have required for my clinical admission that the biopsychosocial always be required and that the clinical master treatment plan always be required. You can see on my screen the other forms that I have made optional so that when a user is completing their encounter, they can choose to add these if they would like. Okay. Now, the main focus of this call, of course, today is required encounters. So here in the upper right corner, you can see a checkbox that says configure due dates. Now, as I scroll down into here, into this encounter, you'll see a section labeled configure due dates. This section will only display if configure due dates is checked at the top. Okay, so as I go down to configure due dates, there are multiple sections here. I have an initial due date option. So for my clinical admission, I have the ability to set a standard for my staff that when a patient admits to a specific level of care, that within 3 days, and I'm able to choose a number in association with hours, days, weeks, or months. But in this case, I chose within 3 days, the clinical admission encounter is going to be due. And now I have the option of assigning this requirement to either nobody, in which case I'll show you momentarily how you would view those encounters that are not assigned to a specific individual. I can also assign them to a team. So if it's a clinical admission encounter, it's most likely that a clinical team would be appropriate to assign this encounter to, which is what I've selected here. If, however, I would like to assign this to a specific user, maybe I'm a smaller organization and I know that one specific staff member is typically going to be responsible for completing this particular encounter, then I may also choose to select specific staff members, one or multiple, to receive that alert as well. Now, I do have the ability to configure recurring due dates. Now, because this is a clinical admission, we're probably not going to be readmitting them on a recurring basis. So I'm going to leave that unchecked for now. And then at the bottom, you see the check mark next to configure due dates based on level of care. So this is going to be the primary standard that most of our clients choose to use the recurring encounter feature, meaning there's a standard set of documentation, a standard set of encounters that have required timeframes in which they must be completed in order to remain in compliance. So I have the option of selecting that this clock, essentially, the due dates will begin due based on admission to, and then you will only see in your system those levels of care that you have available within your system. So what you see on my screen may not match what's in yours, and you will see only your appropriate levels of care. But in this instance, I'm stating that I want outpatient, PHP, and residential 3.5 to all have this particular encounter required from the time that a patient admits to these levels of care. Okay. Now, another situation, well, let's take a look at this actually. Let's go over to the home screen. I will let you know that I admitted a new patient today. His name is Wilson Thurston. Another required encounter that I set up, and it's another great example before I jump into Wilson's required encounter area, is an intake encounter. So with all of the consents, the releases of information, et cetera, those are typically due right away upon admission. So I set those to be due within 3 hours of admission. So when I click on my required encounter screen within my left navigation menu, I actually see Wilson listed twice, as well as a couple of past due encounters. So this screen by default is going to be, well, this is your alert screen. And by default, it's going to display for you the required encounter alerts that are either assigned to the logged in user, or for an encounter that is assigned to a team that the logged in user is part of. So in this case, I know that my user Mimi Shells is part of the clinical team. She also happens to fall on the nursing team. And then you can also see here that it's assigned specifically to her in this instance also. Now, as I review these required encounters on my screen that are assigned to me or one of my team members, perhaps this past due nursing initial visit, I would like to reassign it. I don't want it just assigned to the team, but I know the specific user who is responsible to it. I can change the assignment to a specific user and then select that user from my drop-down list. So I may now save, and instead of that encounter remaining on my view, when Trisha Bird logs in next, she's going to see that in her list because it is specifically assigned to her. Now, going across this bottom portion of the screen, as you may have noticed, of course, we see our patient's name, EMR number. You can also see the encounter name, when the encounter was due, status. So is it due today? Is it past due? In this particular instance, there's not a due date yet because this encounter is not due until the 14th. So it's on there just to let me know it's coming up. And I see that it's assigned to the clinical team. Now, if I would like to jump into my documentation to finish this encounter so that it's removed from my alert screen, I do have access to my patient's e-chart on each row. So I can either jump over to their chart and open a new encounter, or if your organization manages encounters from appointment types, then I can navigate over to my calendar, access the appropriate appointment, and open my encounter from there. Let me just sidetrack because I don't want to circle back around. I know I'll forget. So I don't think I mentioned that 2 ways that you're able to access an encounter are either from the home screen, which is opening an encounter that stands alone from an appointment type. You can just open them at any point in time as needed. You also have the ability to associate encounters with appointment types, so that when an appointment type is checked in, it launches the assigned encounter. So those are the 2 different ways you can open an encounter. I just wanted to mention that, as I mentioned, accessing it from the chart. I will just encourage you that if you are new to AZZLY, or if you're not familiar with how your organization may bill, it's important that you communicate with your super users and ensure that you're opening your encounters from the right starting point, because the place that an encounter is initiated does impact billing. Organizations have a choice to bill by checked-in appointments or by encounters being finalized. So Heather might touch more on that, but I just want to mention that it is important that you open your encounter from the right area. But regardless of where you open it, as long as your encounter is initiated and then finalized, that will alleviate the alert that you see displaying on this screen. Now, for all users who access the required encounter screen, you will see filters at the top of your screen, all of them except the assigned staff. So if you are an end user and not a super user, you can still filter. Maybe I want to see only required encounters within a specific date range, or what I like personally is the ability to move my due date further ahead. So maybe I want to see what all do I have due this week. And maybe today's a slower day and I have some time to get started on some of my treatment plan updates. Then I can go ahead and see what's going to be due this week. And if you are a user who has a large caseload, or you have a long list, on your screen, and you want to filter by patient, you have the ability to do so. Maybe you get in the mindset of, I'm going to update my, I'll use treatment plans again right now, and you want to work on all of those. You can filter by specific encounter type. You also have the ability, if you work out of multiple locations, to view only those alerts per location. And then I'm going to move over this one for just a moment and mention the unassigned. So when I was in the configuration screen, I did mention that you have the ability to assign to a user, a team, or leave it unassigned. If you choose to leave it unassigned, then staff will simply need to make sure that they check this filter so that they have the ability to view those that are unassigned, at which point this column would be blank. All of the other detail would still display, and when needed or when ready, the encounter can then be assigned to the appropriate party. Or as long as someone does finalize the encounter, it would be removed, even if it hadn't ever been assigned. Now, if you're a super user, I think that you may enjoy this screen even more than your end users. And that is for the ability to track the compliance of your team in regards to their required documentation. So this assigned staff dropdown is privilege based by role, and it allows you to not only see your own required encounters, but perhaps I want to see what else Trisha Bird has, for example. I can choose her name, select apply filters, and now I see that Trisha now, she has quite a few more that are past due, so we may need to sit down and talk soon. In this one encounter on top, the vitals encounter, you'll notice there's a number 5 on the past due. This indicates that from the time that this encounter was first due for her, based on the recurrence pattern, she should have actually completed it 5 times by now. So she's behind on these notes. Hopefully, as you use this feature, you don't see this kind of circle many times, but if you do, you'll know that that encounter needs to be completed that number of times in order for your chart to be brought up to date regarding documentation compliance. You can also, when you're in this drop down, click Control A, select all staff, click apply. And then if you wanted to filter your staff by location, you can use these within any combination. Okay. This is one way that I can view this is the place where I can review my required encounter alerts. There is one other place before I turn it over to Heather to discuss the impact on billing. I want to also show you that perhaps you have a patient who one shoe doesn't fit all, or one size doesn't fit all, right? The standard set of documentation was great, that all was assigned to them, but perhaps they have an additional need that you need to make sure stays on the radar. In that case, you may click on the plus sign out to the left of your patient's name in the patient list, and you will see a new tab called the Required Encounters tab. From here, you'll see a schedule of any upcoming encounters that may be due for this particular patient, but you'll also notice there's a button that allows you to add a required encounter. So case management is not an encounter that I assigned to automatically be due for anyone who admits, but for this particular patient, let's say that he has met with his clinician, they've identified some case management needs, and now the clinician needs to set up and ensure that case management meets with this patient in a timely manner. I can select the case management encounter, and from today, start with now, I want to set the initial due date for somebody to meet with this patient for case management. I want this to happen within the next 7 days. And perhaps it needs to, they need to continue meeting at least once every month until the patient discharges from a level of care. Now, if I would like to assign this to a team, I have the ability to. I also have the option, like I said, of assigning to a specific user. So if I know who this person's case manager is, I can select her name and go ahead and save this new required encounter. This is very helpful for those things that come up, even if it's not a recurring required encounter, it's just a one-off. If you need to ensure that somebody or something gets completed by a specific person or by a team within a given time frame, then by setting up this required encounter, you can ensure it will display on their required encounter screen. And if you're a super user, you'll still be able to see that in their all staff screen. If you have an individual who they have a treatment plan encounter that's due every 30 days, but perhaps they have a lot going on in life and you feel that I need to modify this encounter to be due at a different frequency, then you can click edit and you can actually change the frequency of an existing required encounter from this screen as well. The last thing that I want to note is when I was on the configuration screen, I did stay focused on admission to level of care. I do want to note that there's a drop down that also allows you to begin that clock based on a discharge from a level of care. So if you maybe have some aftercare planning, I think I mentioned that, then you can also set up the encounter clock to be based on when they discharge that level of care. So maybe I need to initially follow up with them in 1 week. And then I'm going to make sure I touch base with them at least once every 30 days for 12 recurrences. Then I can establish that quite easily as well. Okay, so I would simply scroll to the bottom, configure that initial due date, maybe within 1 week. And then configure recurring due date once every 1 month for 12 submissions or 12 months. And I can base it off of them discharging from, we'll say PHP in this instance. Okay, so you can use this for those admitting, those discharging, or those one-off encounters that need to be required as you're providing your treatment. That is the primary overview of the required encounter feature. If you, again, are not familiar with encounters or you would just like to dive deeper into anything that I have just gone through, please reach out to client services at AZZLY.com. We would be happy to meet with you and get more granular with this based on your organization's use of this feature. So for now, I'm going to turn it over to Heather so that she can wrap this all up and bring it a full circle with billing.
Thank you, Maria. So compliance is important to the AZZLY system. We try to design everything here within the system to keep you compliant. That the beauty of this system is that the clinical side compliance works hand in hand with the billing side as well. So once you have created your required encounter workflow and attached that to an appointment type or an encounter type, those attached business rules is what we call those to your charge master for whatever service this may be, allows the system to recognize the creation of those encounters or the scheduling of those appointment types as billable claims. Once the charge master configuration is set up and those encounter types or appointment types are tied in, then you have the ability to attach CPT codes, charges, anything that you would need to go out on a claim form. When you've done that, you also have the ability within the patient chart to tie an authorization in for this specific encounter type or appointment type. So again, keeping you compliant, keeping you in line with all of the requirements for a clean submission of this claim. When you come in as the biller, those required encounters that are tied to those encounter types or appointment types list in as whatever it was that you've created, also giving you those color-coded circles at the end of each line item. Expanding that legend in that top right tells you exactly when that encounter has been finalized and signed. Again, keeping your billing team compliant in the case that there were ever an audit, which we strive to keep you free of those. You can rest and know that all of your clinical side documentation was completed and signatures were added prior to this claim being finalized. Finally, pulling in and making everything clean and easy for your billing team. All of the required encounters, pre-authorizations, CPT codes, and everything else automatically populates into your auto claims preview, allowing the system to function seamlessly from that clinical side to the billing side. Again, if you've got more questions about the clinical side required encounters or how this ties into the billing side of your AZZLY system, you can submit those requests to clientservices@azzly.com, and I'll turn this back over to Coletta. Thank you very much.
Actually, may I have one moment? Tracy always relied on her heavily with team, and she actually did bring up some good points that I may not have touched on. So Tracy, if you would like to describe, I'm going to share my screen for one last quick moment, just for a couple of final helpful tidbits, if that's okay.
Excellent. I'd love to. Can you hear me?
We can.
Yes.
Great. I just wanted to point out that in addition to the two things that Maria mentioned, admission forms upon admission and then aftercare after discharge, one of the things that our clients use this the most for is really treatment plans, because you have often that compliance issue with needing to complete a treatment plan every 30, 60, or 90 days. So because you can set these encounters to be recurring, you're able to do that and remind the entire clinical team or the person who is responsible for that to complete those encounters because of this handy pop-up screen that they have. And also I wanted to mention that when somebody has a required encounter assigned to them, on the required encounter item in the left navigation menu, they will have one of those lovely red bubbles with the numbers on them to tell them how many encounters they've got showing. So it's a nice reminder for the person. The second thing I wanted to mention is on this screen that Maria's looking at now, you can sort the encounters that you're looking at by column. So for instance, if I am a supervisor and I want to look at all of my team's required encounters, I can pull them all up and then sort by the status just to see those that are past due and have those rise to the top, or any type of sorting that I want by patient. I can sort by who they're assigned to. So you don't necessarily have to change your filters as often as Maria showed you. You could just sort your columns to show those encounters that way. And then another thing just occurred to me. I wanted to let you know that you can easily delete these encounters as well. On the patient's own screen, every patient has their encounters listed, and you can delete encounters so that if somebody has discharged and somebody forgot to, discharge them timely and you want to delete their encounters, you can do it here. So you're not stuck with those reminders forever for somebody who discharged and somebody missed a step. All right. Sorry to have interrupted. Thanks very much for letting me share.
Great points that you brought up, Tracy, especially the deleting of an encounter that may not be needed and the treatment plans. Thank you.
Sure.
Yeah, thank you all, and Tracy for your participation as well. Just a friendly reminder, everything is written up in the e-learning platform so that you can read about the required encounters. It is not a requirement. You can start easy, as Tracy mentioned. If it's purely treatment plan review, start slow, get used to it, get comfortable with it. And I think you'll find it as a really a wonderful tool, compliance tool for all of your users. I want to thank you again. Andrew's going to put up a quick poll, just those who are familiar with the encounter, using the encounter. Again, it's a shift from pulling forms out of the drawer, shifting to the encounter for auto billing off of appointment types, auto billing off of the encounters. It is invaluable to make that shift to the encounters. So again, thank you for joining today. We appreciate your participation. If you have a few minutes, finish the poll, and we'll see you next time. Andrew will keep you informed when our next educational series is. Thank you.
Thank you.